Today, we are excited to welcome Dr. Leigh Anderson. Leigh currently serves as the Executive Director of the Police Accountability Team for the City of Cleveland. Prior to coming to Cleveland, she served as an assistant professor in the Department of Criminal Justice Studies at Southern Illinois University and as the contractual Chief of Staff for the City of Oakland Office of the Inspector General under the city's Police Commission. Previously, Leigh served as a Chief Performance Analyst in the public safety section of the City of Chicago Office of Inspector General. She also continues to consult with a number of police departments to assist with police accountability and reform. In the world of academia, she has taught various courses related to policing, including traveling back to her alma mater, Howard University. She is also a former assistant professor in the Department of Criminal Justice, Political Science, and Philosophy at Chicago State University. And she works with the Ohio State John Glenn College of Public Affairs Management Advancement for Public Service Program. She has traveled to produce studies and research and is a co-author of books and publications. She is also very active in our community. She serves on the board of directors of the Rainey Institute and the board of directors for the Journey Center for Safety and Healing. She has been recognized for her leadership, including being named one of Crain's Notable Black Leaders for 2024, one of the inaugural recipients of Engage Cleveland's 24 in 24 award, and a 2023 recipient of the 40 Under 40 award in Crain's. And we are also so proud to call her a graduate of the Leadership Cleveland class of 2024. I am excited to pass it on to Dr. Leigh Anderson.
Thank you so much, Rachel. Good afternoon, happy lunch hour. Thank you so much for taking the time to just join this talk. Again, I'm Dr. Leigh Anderson. It is a pleasure to take some time to speak with others about the work that we do so passionately. And with that, I'll get started. So, I do want to give a thank you to Cleveland Leadership Center for the invite. I am just astonished when I got it. And so I am just very much grateful. So thank you. All right, let's get started. Okay. I have to do this correctly. Okay, Rachel, am I?
We need to put it in the
that's right. Sorry, everyone. There we go. Okay, so the police accountability, is this, do you guys see? No, you guys see presenter mode, or you see?
It's all good.
Okay, thank you. It's about to have a panic attack. Okay, great. So the police accountability team and the consent decree, let's get into it. So I like to start off with this quote by John C. Maxwell: change is inevitable, but growth is optional, right? So things around us are going to continue to change. Whether or not you choose to change and grow is up to you. And so I'd like to really give lots of credit to the city of Cleveland as a whole, the community, the police department, the nonprofits here, because there is a conscious effort to grow, and especially in the area of police accountability. And I think that that's admirable. So what does that look like? So let's start here. Why are we in a consent decree? So in 2013, city officials called for an investigation from the DOJ after repeated uses of force, and they were excessive uses of force. So the DOJ carried out its investigation, a very detailed investigation, where it found, among other things, that there was a pattern of using excessive force and violating the Fourth Amendment of the United States Constitution. With that, the Department of Justice and the city of Cleveland entered into a settlement agreement. And that was in 2015 to reform CDP. And as you see here, the investigation was completed and published in 2014. So that'll come into play a little bit later in the presentation. So what is a consent decree? Essentially, it's an order made by a judge with the agreement of all parties to carry out whatever's in that order. So our consent decree has about 400 paragraphs related to reforming the police department, essentially brick by brick. So we'll talk about what that looks like. In Cleveland, the consent decree is an order from Judge Solomon Oliver of the Northern District of Ohio. Okay, and it requires that we undergo extensive reform in the area of police accountability. So, what areas are of interest? So, there are 8 areas in our consent decree: community engagement, community and problem oriented policing. Okay, we have bias free policing, use of force as an area, crisis intervention, which we'll talk a little bit about, search and seizure, Fourth Amendment rights, accountability, transparency, and oversight. And then we also have officer assistance, support, and supervision. So these are our 8 areas that we focus on, and these culminate into 400 paragraphs of directions towards reform for the city of Cleveland. So paragraph 385, I know I mentioned 400 paragraphs, right? So we're getting close to the end, but what it does is it creates a consent decree implementation unit, okay? And it forms a unit with the skills and abilities necessary to facilitate compliance with the settlement agreement. Specifically, this implementation unit is to coordinate CDPs and the city's compliance and implementation activities and facilitate the provision of data, documents, materials, and access. So that turned into the police accountability team, okay? And so I was the first member of the team that was invited to come by Mayor Justin Bibb, created the police accountability team underneath his tenure. And our main goal is to achieve compliance with the consent decree. Okay, so our day-to-day work, again, continuous collaboration. There's not a day that doesn't go by that we're not either on the phone, communicating, talking to, in a meeting with the Department of Justice or the federal monitoring team or other partners in the city. We also conduct policy reviews, internal audits, and critical data analysis. Okay, we do this to capture compliance results and make recommendations. And then we're also committed to 21st century best practices and constitutional policing. Okay, and this is not just toward the consent decree, but beyond. So, who is the police accountability team? There we are. So, it's myself, and then we have Hannah Macias, who's our performance auditor, Nicoya Washington, project manager, Martin Belat, who's an assistant director of law, and Carlos Johnson, our other assistant director of law. And if you notice, our team is very new, right? So the police accountability team just started in November of 2022. So we're going to talk about some of the work that we've been able to accomplish in that time. So we went on ride-alongs in each district on various shifts, right? So we can't learn or direct or instruct or facilitate anything until we know those who we're working with, right? So this includes going to community events, but also just really making sure that we understand what's happening out in the field that needs to be changed, okay? And before anybody asks, the officers' faces are only blacked out or because we did not ask their permission to be on this slide. So no, for no other reason. I get that question a lot. All right. So we also have funding to do site peer visits with other consent decree cities. So we did site-to-site peer visits. We went to Albuquerque. We also went to Baltimore. We were able to go to court with Baltimore. So we were able to see their consent decree process, move through their court system. And then we also present at 6 a.m. Imagine how early we have to get up, roll calls for the officers and just presenting to them about the consent decree, talking to them about what it means, what is expected of them, and just really engaging to really address any misnomers and to really provide information to them. All right, doing the work. So, as I mentioned, we conduct audits and we assess compliance with every area of the consent decree, all the 8 areas that I talked about previously. Okay. We also identify areas that are ready to be presented to the court and the monitoring team as what we call substantially compliant. Okay. So what does that mean? It means that whatever the area is, it has all of its policies completed. So everyone always asks, rightfully so, the question of this has taken 10 years, right? And there isn't, it was set to take 5 years, but in my experience, I've never seen a consent decree finish in the time that it was allotted for in the actual settlement agreement or consent decree. I'm not making a judgment on whether or not that's good or bad. It's just a fact. Okay. And so with that fact, I want to note that Cleveland has taken its time, but what I would assess as someone from the outside first before coming in, to try to get it right. Right now that I'm looking at policies, there aren't a lot of policies that have to be revisited. Right. So policies for all of those 400 paragraphs in those 8 areas have been completed. We also understand that trainings have been completed in those policies and that many of those areas are ready for assessment. And we'll talk about what assessment means in this case. We're also breaking down the consent decree in paragraphs into specific tasks and duties. We're at over 1,000 tasks thus far that the city has to complete. Okay? And we're still counting. All right, so assessment progress with the consent decree. So first you have to reform the policy, right? So whatever the use of force policy was previously, it needs to be scrapped and it had to be written from scratch, okay? With that, you have to also write the training and implementation policies and procedures that go with that policy, that reformed policy. And then what we do is we assess it, right? So the monitors can come in and go out into the field and or look at spreadsheets, right? So the point of this is to make sure that the policy is complete, the training is complete, it's been properly implemented, and now we're at a space of being able to be assessed and audited. Now, I will say it did take 10 years, but I will say that I also don't know, and I'm not making a judgment call on how long that would have taken or should have taken when you're reforming policies for a metropolitan police department, right? And so, nonetheless, we are happy to be at this stage where we are able to put forth areas for compliance in assessment, okay? So our current assessments include, so out of the 8 areas, we have crisis intervention, use of force, and search and seizure. And these are all areas that are currently up for assessment right now, formal assessment with the monitoring team. If they find out that we are in compliance, we are able to move into what's called a 2-year sustainability period by the judge. If we maintain our progress for that 2 years, we will be released from that area of the consent decree completely, okay? So we have 3 of the 8 areas that are there. And I think that that's really important because crisis intervention, use of force, and search and seizure is really how we sort of got here. And so it's important that we are addressing those areas to be able to move forward. Which leads me to my next slide. So the Sankofa, all right. Sankofa is a Twi word from the Akan tribe of Ghana, and it loosely translates to go back and get it, okay? Or it's not taboo to go back for what you forgot or left behind. Essentially, Sankofa is a phrase that encourages learning from the past to inform the future, reaching back to move forward and lifting as we climb, okay? So that is important because I want to move to some then and now scenarios. All right, so then for the Department of Justice, their investigation in 2014, they noted that the use of force aggregate data and trends should be monitored to enable the division to identify and address emerging problems before they result in a significant or widespread harm. So the city now has an open data portal, okay? And the open data portal is actually a space where we're able to move into, let me move back a little bit, and it has information about city operations, services, and other areas such as police calls for service, right? So we have that data now that's open to the public, okay? Let's do one more. All right, then our review of reports and investigations of officers' use of force, both deadly and less lethal, revealed that CDP officers lack some of the basic support, skills, and knowledge required to safely and effectively respond to situations that commonly arise in law enforcement encounters. So that was in 2014. Where are we at now? So what we understand from the monitoring team is that a review of 2024 Q1 and Q2 data preliminary show that all uses of force were within policy, okay? It also shows that there was one incident that was out of policy, but it was appropriately identified by the chain of command and handled adequately. All right. And then we have crisis intervention. So crisis intervention policies and practices are underdeveloped, and CDP has not yet fully integrated these practices into its response to individuals in crisis, resulting in the use of unreasonable force against these individuals. So we now have a crisis intervention team program where we develop a foundation to effectively assist those in crisis. Okay. And I want to go into this because the specialized pin that you see is the pin that the officers wear that are CIT certified. And this is important because the uses of force, I want to note that we are under the national average for crisis intervention uses of force. In fact, and I pulled this right from the data portal this morning. So we have 99.58% of without use of force, right? So that's less than 1%. And so I want to talk a little bit about the path forward before I wrap up. So we're just continuing to meet internal and external stakeholders where they are and making sure that we are approaching compliance measures. We're determining what priorities do we need for compliance. We'll continue our presentations. We also present at the police academy and at command staff meetings so that police officers know what to expect per the consent decree when they come out, and supervisors understand what to expect from their designees. We also are assigning consent decree tasks, just working to demonstrate progress and emphasizing the importance of community relations, just aimed at building trust and receiving feedback on the reforms thus far. So that is my presentation, and I am open to questions. Let me stop sharing.
Leigh, thank you so much. So you outlined so much learning that you and your team have done over the couple of years. Um, what have been some of your biggest learnings to date through that engagement with the police officers in the city and the community?
That there needs to be more conversation, more dialogue, more doing, more activity, more execution, just across the board, right? And so I think that that the public, right? I appreciate the public and the community. They are really involved, right? And that is something that we see in communities that are dealing with police accountability issues overall. But I think that another challenge is just making sure that both groups talk. And just that I just mean law enforcement and in the community, right? Just creating more opportunities for them to talk while the community is holding them accountable and while they are looking to serve the public.
How has police training evolved since the establishment of your unit?
So let me say police training was already rocking and rolling, right? So it was under Commander Magooth when I first got here. And he has gotten amazing marks from the monitoring team just throughout being in the training division. And so what we see is we see responsive training, we see response to, how can I put it? Response to the training, response to just what the objectives and the priorities are for those courses. And we really see that there is more engagement and involvement from the officers when they're in the classes, because there is the support of them for learning and education and continuing to move forward.
Have you had access to the data compiled through the Adams Board through the Mental Health Response Advisory Committee to help guide your work?
Absolutely. So we work with MRAC a lot. We're currently working on the annual report. Well, I'm not working on it. My team is working with the public health department, which is working on it. And they are working very closely with the Adams Board. We meet with them monthly. And the Adams Board is also included in our meetings with the DOJ and the monitoring team.
You mentioned that you did some research, some visits, some learning from other cities. What are some of the communities that you learned the most from, and what might you have brought back to your work?
That's a great question. Um, so let me say this. This is kind of hard to answer. It's kind of for me, it's a professionally sad question to answer. Um, Consent decrees that came after Cleveland essentially built their consent decrees on the back of Cleveland, right? So there are cities that negotiated things out of their decree that Cleveland has. I'm not making a judgment on whether that's good or bad. This is a fact, right? So they negotiated things out of their decree. And do I think that harmed them or helped them? I'm not quite sure. We're still going through the processes of implementation to sort of figure out. But one of the things that I learned is that every decree is different. And I knew that before because literally written, every decree is different. There are no decrees that are alike, no two decrees. And one of the things that I would say is that the experiences in each city have been really idiosyncratic. So I cannot really say that, oh my goodness, I'm going to take exactly what I learned from Chicago and apply it in Cleveland, right? So that is something that I think we have to look at, right? Like my grandmother says, right? You want to chew the meat and spit out the bones, right? And so with this, it's like, what can we take? And so we were able to take multiple things from different cities that were that had to do with resources, communication with the judge, better communication with the monitoring team and Department of Justice. What does that look like, right? And we were also able to take away community conversation. So long answer, but to say not no two cities are alike, but we were able to take away a lot of great things.
Looking outside of the city, who are organizations that you collaborate with, that you partner with to advance your work?
Yeah, so we collaborate a lot with the National Policing Institute. We also work with IACP, the International Association for Chiefs of Police. We also work with the Major City Chiefs Association. And so those are lots of police organizations. We do a lot of presentations in the community, which I'd like to include in the space. And so that is something that, you know, we would like to get more into for that. Yeah.
Once the policy is written or improved, how does the accountability team assess how effective that policy has been once in practice?
Yeah, so that's a great question. So the accountability team doesn't really assess it. What we do is we prepare it for the monitoring team to assess it, right? So we make sure and we do a preliminary audit, so to speak. And so what we do is we make sure that all the documentation is there. We make sure that all the forms are filled out. We go through and make sure that that if there is officer information that's missing, that is put in place. And then we also conduct an audit to make sure and assess that everything is ready and prepared for the monitoring team to go through and execute their methodology.
So, Lee, as we are dealing with this kind of ever evolving climate, nationally, state-wise, locally, how are you taking into account in kind of working with the police, with the city, to ensure kind of communities are supported and have kind of that equitable respect and access?
Mhm, mhm. That's something we're still working on. And I think that is something that, like I said, kudos and to the community for wanting to be a part of this process, right? There are cities that where that's not the case. But it is a breath of fresh air to see it in Cleveland. And I also think that there are opportunities for the community and the police to coalesce. And I think that comes in place when exactly right, when rights are respected, when just respect is given, when procedural justice is executed. And I also think that we could do much more once we understand sort of how far we've come in this process, right? So I think that because, right, the idea here is that the city is not compliant, right? I think it's right to say we just haven't been assessed yet for that compliance. And so that's just a different paradigm shift that looks at the same topic, but just says, we're ready to move to the next level and to get that engagement and see where the gaps are so that we can see if there are community members that need to be focused on other than what is happening now.
And for those who are interested in engaging in this process, how might they get involved and how do they feel like they kind of are welcomed to the table?
Yeah. District policing committee meetings is what I'll say. So the monitoring team is really looking for diverse representation at the district policing committee meetings. And those are meetings that are held within your particular police district. And they encompass just sort of not just areas of the community police commission, right, at the end of the year, but also the community relations board, and so and as well as the police commanders and their staff, right? So it's a great opportunity for me to say to take that first step to try to get involved in and locked in into what's happening in the community and that communal space.
As you look ahead, what are the next steps that your team is taking? And what's that longer term vision?
Mm. The next steps are just preparing more areas other than the use of force, crisis intervention, and search and seizure to become areas ready for assessment to prove to the judge, and the community that work has been done, work is actively being done, and as a result of that, progress is being made towards compliance. And leading into the future, it is really the dissolution of the consent decree, right? But understanding what those practices mean beyond the consent decree leaving. I think now it's time, right, for the community to start having those conversations about what it would like to see, because this is something that we're endeavoring to do and work is being done. And I understand the consent decree right now is front and center, but we are really seeking to execute compliance. And with that, we're looking for what the sustainability of this progress means in the community and the neighborhoods.
For folks who want to get involved or stay up to date, where can they find information about your work and those opportunities?
Yeah, so we have a consent decree page that is on the website, the new city website. I actually have a meeting today. We're looking to update it, make sure it's all up to date for everyone that is interested in reports that have been written, assessments that have been conducted, and actually just the decree itself, right? Looking to read that, the investigation itself, and understanding how we got here.
Well, Leigh, we thank you for your time today. It was a quick conversation on such an important topic, and we encourage everyone on the call to please follow up, learn more, share your thoughts. And Leigh, thank you for all the work you and your team is doing in our community.
Thank you.